Hello, I'm Dr. Adeola Adewole. I'm the Clinical Director of a clinic here in Swords, Sims IVF. During your initial presentation to us, you're going to be having a consultation with the nursing team first. At that visit, you're going to have some blood tests done. Some of these blood tests may have been done by your GP, which may not be necessary to be repeated. Other blood tests may need to be done to assess your egg reserve and your hormone profile. You would also be having an ultrasound test done to assess the womb and assess the ovaries. Following consultation with the nursing team, you will then have a consultation with one of our doctors. At your consultation visit with the doctor, you're going to be introduced to your doctor, and either yourself alone if you're coming to us or yourself and your partner, your history will be taken. We'll try to get as much information about your medical history, your health-wise, how long you've been trying to conceive, and general overall health. Following that, if further investigations is required, that will be arranged, or if the doctor at the time feels it's time to move forward to treatment, then we'll be ready to proceed. There are three main treatment options available. The first is called ovulation induction. The ovulation induction involves you having tablets or combination of tablets and injection to stimulate the follicle to grow in your menstrual cycle, and you have the opportunity to have intercourse at home. Ovulation induction is often used as a treatment option, particularly when you're under 35 and you're not ovulating regularly. The second treatment option, it's called IUI, which is intrauterine insemination. Similar to the ovulation induction, you'll be given a tablet or injection to allow follicle to grow during your menstrual cycle, but the option of having the sperm inseminated into the uterus. IUI may be used as a treatment option where there is mild male factor, or in younger people that have been trying to conceive for a short period. May also be an option for treatment in a single woman and also in same-sex couple. The third treatment option, it's an IVF, which literally translates to fertilization within a dish, which means fertilization outside the body. The process of IVF usually involves a pre-treatment phase, a stimulation phase, egg collection, and embryo development. And the final stage usually involves transferring the embryo back into the uterus. The pre-treatment phase varies depending on the treatment option chosen and the treatment plan chosen by your doctor. This can vary between 0 days to up to a couple of weeks. And during this time, the treatment phase often involves you doing that at home without much medical involvement. The second phase, which is the stimulation phase, involves you having 1 or 2 injections daily at the same time, usually given in the evening, and this process can take about 10 to 14 days, plus or minus a few days either way. During the time of the stimulation phase, you're going to have some blood tests and you would have some ultrasound scan as well. The idea of the stimulation phase is to get more eggs than we would normally do in one menstrual cycle in order for us to be able to fertilize outside the body. During the stimulation phase, you're also going to be monitored to see how you're progressing, and eventually you will be ready for the egg collection. The third phase involves having your egg collection. This is usually done under sedation, and the follicles that have been growing during the follicular phase or stimulation phase are now going to be collected. It is done as a day procedure. Usually takes somewhere between 20 to 40 minutes. And all the eggs that we've been trying to grow during the stimulation will be collected with hope to fertilize outside the body. The next phase involves fertilization of the egg and the sperm in order for us to create embryo. This process takes place in the lab over the course of 5 to 6 days. And during this period, your embryo will be monitored, and we use a microscope to see how these embryos are developing, because there's a camera attached to be able to see how your embryo is growing to form what we call a blastocyst on day 5, day 6. Once we have an embryo, we then come to the final phase of your IVF treatment, which involves putting the embryo back. The embryos are usually put back on day 5 of the embryo development, following an egg collection, but in some cases may need to be done a month or 2 later in a frozen embryo cycle. IVF is a treatment option that is available to all, but generally considered in younger people, that is over 35, if they've been trying to conceive more than a year and they've tried other treatment options. IVF may be considered as a first-line treatment in the setting of you being over 35 and you've been trying for 6 months or more. This depends on what other treatment option you may have had previously, or whether there are other factors such as male factors, issue with the sperm, that may affect fertility. One of the main tests we do during your initial presentation is to do an AMH blood test. This is called anti-Mullerian hormone, and it's looking at your egg reserve in relation to your age. The younger you are, the higher the AMH levels will be. And in general, it's a good predictor of how you're going to respond to treatment. As part of your initial investigation, you're going to be having a transvaginal scan. This is an internal scan that is done to assess the womb and also the ovaries, your ovarian reserve, and the position and location of the ovaries. An egg freeze process is a process where you have a stimulation of the ovary over the course of a 10 to 14 days period, in which case after the stimulation phase, your eggs are collected and then frozen for you. With an embryo freeze, you will still have the stimulation process over the course of the 10 to 14 days. The eggs are collected, but the eggs are then fertilized with the sperm in order to create embryos that are then frozen for you to be able to use in future. In IVF, the eggs and the sperm are left in the dish overnight in order for fertilization to happen, and the egg and the sperm can meet and create embryo. Generally, IVF is used as a treatment option when the sperm motility, morphology, and the count is normal. With ICSI, or ICSI, also known as intracytoplasmic sperm injection, each of the eggs that mature are injected with a single sperm in order for fertilization to happen and create embryos. The main thing with ICSI is that it's often used when there's male factor in the setting of low count, low motility, or low morphology, or in some cases when all 3 parameters are low. So what is a blastocyst? A blastocyst is a form of embryo that is created after 5 to 6 days of fertilization. So at the first day after fertilization, we are looking to see if the sperm and the egg is fertilized to create 2 cells. Once the embryo grows, over the course of the 5 to 6 days, it will then form at least 100 cells, and at this stage, it is called a blastocyst. Thanks for having me. I'm Dr. Adeola Adewole, Clinical Director of Sims IVF SWAT. For more information, visit us at sims.ie. Thanks for listening. We look forward to having you at the clinic. Have a lovely day.